For your learning objectives at the end of the module, the students will be able to, number 1, define hormones, and number 2, classify types of hormones. But before we head on to our main discussion, which is about your hormones, let us just have a quick recap of our endocrine system. So they are connected with one another because your hormones, nag-originate sila sa ating endocrine system. So importante na ma-discuss lang po natin kahit quick review lang of your endocrine system. Your endocrine system is made up of glands. Okay, again, it is made up of glands. And what are glands? Glands are any structure that makes and secrete hormones. Again, your endocrine system is made up of glands, and glands are any structure that makes and secretes your hormones. And the hormones they secrete, although the endocrine glands are primary hormone producers, meron din daw po tayong different body organs that are capable of producing and releasing your hormones. And what are those? We have the brain, heart, lungs, liver, skin, thymus, gastrointestinal mucosa, and the placenta to produce and release your hormones. Okay, yung ating endocrine system, primarily, it is being comprised of different glands. Again, those glands are structured that are capable of making and secreting your hormones. And also, your endocrine system works hand in hand with your central nervous system. Because your central nervous system are the ones who makes the demands na nagsasabi na, hoy, endocrine system, i-produce mo tong hormone na to. I-produce mo tong hormone na to, ganito, ganito, ganito. Okay? Sila po yung nagme-make ng demands. Also, your endocrine system, the function of endocrine system is the production and regulation of chemical substances on what we call your hormones. Okay? Next. So, i-identify lang po natin yung different glands that are involved in your endocrine system. We have the pineal gland, yung cone shape dyan, taas. Okay, we have the pituitary gland and hypothalamus. Nandito siya. I know hypothalamus is involved in the central nervous system. However, meron din po siyang mga function in your endocrine system. Next, we have the thyroid and parathyroid gland. It is in the neck area, pansinin, and in the front of your trachea or your windpipe. Next, we have the thymus. Okay, sa abdomen part naman po tayo, we have the pancreas. And then, yung adrenal glands nandun sa kidney. And then, meron tayong collective term for yung ating lower extremities, yung glands natin doon. We have the testes for the male and for the female, ovaries and placenta. If collective term siya or general term, ang tawag doon ay gonads. Again, nung ating mga glands, we have the same pagdating sa babae and sa lalaki, nagkakaroon lang ng main differentiation sa gonads natin. Sa male, testis yung tawag. Sa babae, ovaries and placenta po yung tawag. Okay, collective term ang ating gonads. Okay, proceed na tayo doon sa ating pinaka-bida or star ng ating discussion. This is your hormones. Hormones are chemical messengers synthesized by specialized cells secreted into the circulation in response to a stimulus. Saan po nasisikret yung ating hormones? Mainly po in the bloodstream. Okay? The hormone circulates to distant target cells and elicit effects. Your hormones, kaya lang naman po sila nare-release because of a stimuli. Okay? They are being triggered because of a stimuli or a stimulus. And then these hormones, they are chemical messenger that send signals papunta sa ibang hormones din or papunta sa ibang body organs. And then, pag napuntahan na nila yung target cells nila, nagkakaroon po sila ng different effects. Again, your hormones work as a chemical messenger secreted in the bloodstream due to a stimuli, and then they go to different target cells and then they will elicit effects. Na-imagine po. So next, your hormones, they have its hyposecretion and hypersecretion. Again, pakitandaan lang po muna for now. Your hormones, it has hyposecretion and hypersecretion. Kung ano po yung mga nangyayari during hyposecretion and hypersecretion, i-discuss natin siya later on. Next, your hormones, they regulate the growth, the development, the mood, the tissue function, metabolism, and sexual function. Okay? Next. So we have different classes of your hormones. We have three. Okay, we have the peptides and the proteins. They are synthesized from your amino acids. Next, we have the steroids. They are synthesized from your cholesterol. And the amines. They are derivatives of tyrosine. Pakitandaan po yung mga yan. So, discuss na natin siya isa-isa. Unahin natin si synthesis of peptide and protein hormone. So, majority daw po ng mga hormones na nagsisirculate into our bloodstream, puro sila peptides and proteins. Again, hindi lahat, pero majority. Next, the releasing factors are peptides. And then, pakitandaan po that the hormones are water-soluble. These peptide and protein hormones are water-soluble and they do not require transport proteins to move through our blood. Okay, they are synthesized and stored within the cell and have a short half-life of 5 to 60 minutes in our circulation. Again, yung unang class ng hormones na pinag-usapan natin, it is your peptide and protein hormones. Majority nga daw po ng hormones natin, puro sila peptide and protein, and they are water-soluble, and they do not require transport proteins. Next, proceed na po tayo sa ating next class of hormones, which is your steroid hormone. Steroid hormones, they are derivative of your cholesterol. Pakitandaan po. And it occurs in your adrenal cortex, corpus luteum, your gonads, and the placenta. Your steroid hormones are involved in the regulation of sexual development and characteristics. Again, steroid hormones involved in the regulation of sexual development and characteristics. Pakitandaan din po kay steroid hormones, they are not water-soluble kasi po, they are lipid-soluble. Okay? Cholesterol nga po siya eh. So mainly, lipid-soluble siya at hindi siya water-soluble. Okay? Yung analogy natin doon. And then, they require a transport protein to travel through the blood. So steroid hormones are synthesized in the adrenal glands, gonads, or placenta and have a long half-life of 60 to 100 minutes in the circulation. Again, your steroid hormones, mga derivatives sila ng cholesterol, hindi sila water-soluble, ano po sila, mainly involved in the regulation of sexual development and characteristics, and they require transport protein. So, tatandaan po yung mga statements na yon in regards to your steroid hormones. Next, we have your amine hormones. Your amine hormones, they are derivatives of your tyrosine. Pakitandaan po. And it includes these following, yung catecholamines natin or catecholamines. We have the epinephrine, norepinephrine, and dopamine. And then yung mga thyroid hormones natin. So, ayan. Maging familiar po muna kayo sa classes of hormones natin. If it is under peptide or protein, steroid hormones, and amine hormones, mas makakabisado nyo siya later on kasi magbibigay tayo ng table and chart. Okay. So, mas maganda po siguro na kabisaduhin natin yung mga hormones that are under each gland depending kung saan nyo siya natatandaan. So, ituro mo muna nasan si hypothalamus. Okay, doon po na po produce yung ating ADH, antidiuretic hormone, your oxytocin, and regulatory hormones. Pag sinabing pituitary gland, meron tayong dalawang lobe. We have the pituitary, anterior pituitary, we have the posterior pituitary. Pag anterior, pinag-uusapan, nandyan po yung production ng ACTH, yung mga TSH, your growth hormone, prolactin, FSH, LH, and then your MSH. Your posterior lobe naman, nandiyan yung release of your oxytocin and then your antidiuretic hormone. So, maganda, nakabisaduhin natin siya pababa. So, kung titignan natin yung thyroid gland, ano po ba yung mga napoproduce natin na nasisikret na hormones doon? We have the thyroxine, the T4, and then the triiodothyronine, which is the T3, and then your calcitonin. Okay? Mas maganda po nakabisaduhin natin siya, depending kung paano yung approach ninyo in memorizing this. So, hindi lang po kakabisaduhin, pero aaralin natin siya isa-isa. So, mas maganda na meron ka ng idea. So, nasa adrenal medulla, ano nga ba yung nandun? Si norepinephrine and epinephrine. Pag ovaries, automatic estradiol and progesterone. Ayan, kabisaduhin po natin. So, for your hormones, we have what we call your negative feedback and the positive feedback. So, ang tawag doon sa dalawang yon, feedback mechanism. Feedback mechanism. So, what happens during your positive feedback? For example, meron kang stimulating hormone na nag-increase. So, ang mangyayari doon, positive nga po, di ba? So, yung kasunod nun, yung mga processes and the production ng ibang hormone, tataas din po, kagaya nito. So, sa hypothalamus, meron kang nag-increase na TRH. Ang kasunod nun, yung si-signal niya si pituitary gland to produce itong hormone na to, and then sa thyroid gland, ganito din po. So, positive feedback siya. Parang domino effect na nagkaroon ng increase. Itong isang gland, nag-release ng hormone na nag-increase. Yung kasunod na gland, mag-i-increase, as mag-i-increase, as mag-i-increase. So, yun yung tinatawag na positive feedback. Meanwhile, for the negative feedback, it occurs when stimulating hormone induces the production of a hormone. Ang ibig sabihin po nun, parang hatakan pababa, parang ganon. Pag may nag-increase na isa, ang tendency ng isang hormone is pabababain niya yung increase ng isa. Kasi nga, masyado siyang mataas itong hormone na to. Okay? Ang tendency nun, yung isi-signal niya dun sa kasunod na gland is pababain yung release. For example, meron tayong high level of thyroid hormones. Okay? Thyroid hormones. High level yan, yung thyroid hormones natin, mataas masyado. Ang gagawin yan, it will stop the release of your TRH na nandito sa taas, sa hypothalamus. Okay? Para po, hindi masyadong tumaas yung levels na sa katawan. Kasi nga may problema na dun sa thyroid gland, kaya mataas yung thyroid hormone. So, ang gagawin niya, isi-signal niya po yung hypothalamus na hindi masyadong taasan or pababain yung release noong TRH, or what we call the thyrotropin-releasing hormone. So, ganun po siya. Nagpipigilan sila. Whereas for your positive feedback mechanism, pag tumaas yung isang stimulus hormone, stimulating hormone, tataas din yung process, and then tataas din yung production. So, yun po yung feedback mechanism of positive and negative feedback of your hormones. So, isa-isahin na po natin yung mga hormones according to their gland. And then, i-discuss natin isa-isa yung mga diseases associated with it. Start po muna tayo kay pituitary gland. Si pituitary gland, it has its anterior and posterior lobe. Okay, ito siya. So, unahin natin si anterior pituitary gland. We have the growth hormone. Your GH or your growth hormone. It is essential for the growth and development of muscles, bones, and other organs. It also enhances the protein synthesis, decreases the use of glucose, and promotes fat destruction. Okay? Again, your anterior pituitary gland, we have the growth hormone that are essential for the development of a person. If meron pong hyposecretion, mababa yung pagsisecrete, mababa yung level ng growth hormone, ang mangyayari po, magkakaroon ng dwarfism yung pasyente. Okay, dwarfism kasi nga essential po ang ating growth hormone for the development of different body organs. So, ang tendency, pag masyadong mababa yung level sa katawan, affected din yung different body organs. So, nagkakaroon ng dwarfism. Next naman po, what if naman may hypersecretion? Sobrang dami naman po nung level or nung pag-produce ng growth hormone sa katawan. Pag po matanda yung pinag-uusapan, pag sa adult, ang tawag po doon, ang hypersecretion sa adult, ang tawag doon ay acromegaly. A-C-R-O, megaly. Acromegaly. It is the progressive enlargement of distal parts of the extremities. Kung mapapansin ninyo, paki-google na lang po, may mga picture tayo doon ng acromegaly patients, malalaki yung kanilang mga hands, pati yung mga mukha, yung mga jaw, malalaki. Kasi nga, may hypersecretion of the growth hormone in the adult. Meanwhile, pagka naman may hypersecretion of the growth hormone in the children, okay, ang mangyayari, mayroon gigantism. Gigantism. Okay, so yun po yun. These hormones affect our extremities and other body organs in a way that it affects. Kung mas mababa yung production, mas lumiliit din yung mga extremities. Pag masyadong madami yung production, lumalaki din po yung mga extremities. This is applicable for your growth hormone. Next, punta naman po tayo kay anterior pituitary gland pa din. Nandito na po tayo kay ACTH. ACTH is essential for the growth of the adrenal cortex. Again, your ACTH is essential for the growth of your adrenal cortex. Next, we have the thyroid stimulating hormone, which is under your anterior pituitary gland. Okay, it is essential for the growth and development of your thyroid gland. Again, TSH is important or essential for the growth and development of your thyroid gland. Excuse me. Okay, next po. Under pa rin po tayo ng anterior pituitary gland. Pag sinabi naman pong follicle stimulating hormone or FSH, which is under pa rin po ng anterior pituitary gland, it is a gonadotrophic hormone. Again, it is a gonadotrophic hormone. And then yung hyperproduction nito or hypersecretion results in sexual precocity, Precocity, and usually results in from your brain tumor. Again, your FSH is a gonadotropic hormone and hypersecretion results in sexual precocity and usually a result of a brain tumor. What if naman hyposecretion? What happens? Nagkakaroon ng sexual underdevelopment yung patient and infertility. Okay, your FSH, it stimulates the growth of ovarian follicles in the female and the production of sperm in the male. So, balikan lang po natin ng mabilis yung ating TSH or your thyroid stimulating hormone. Pag meron pong hypersecretion nito, nagkakaroon ng thyrotoxicosis. Thyrotoxicosis. Pagka naman hyposecretion siya, hindi natin din masasabi kasi na hypothyroidism yung tawag kasi meron pong isa pang hormone that is affecting your thyroidism, di ba? Yung pagiging hyperthyroidism nyo or pagkakaroon ng hypothyroidism. So, for the hyposecretion, it is difficult to differentiate from hypothyroidism. Pero ang tatandaan natin kay TSH, pag hypersecretion, thyrotoxicosis po ang tawag. Next, punta po rin naman po tayo kay anterior pituitary gland. Nandito pa rin tayo sa anterior pituitary gland, which is your luteinizing hormone. LH or your luteinizing hormone is a gonadotropic hormone stimulating the development of your corpus luteum in the female ovarian follicles and the production of testosterone in the male. Okay, so the corpus, the yellow corpus luteum remains after the ovulation. It produces estrogen and the progesterone. Next, under pa rin ng ating anterior pituitary gland, which is what we call your PRL or prolactin. It stimulates the development and growth of the mammary glands and milk production during your pregnancy. What else? The sucking motion of the baby stimulates the prolactin secretion. So pagka talaga mga breastfeeding mom, yan, naglalactate po sila. This is due to the help of the stimulation of your prolactin. Under pa rin po ng anterior pituitary gland, which is what we call the melanocyte stimulating hormone or your MSH. It regulates the skin pigmentation and promotes the deposit of melanin in the skin after exposure to sunlight. So yung mga melanin po natin, nag-work sila to protect our skin from the UV light para hindi tayo magka-cancer. So yung nag-stimulate po ng release nun is under the anterior pituitary gland and yun yung tinatawag natin na melanocyte stimulating hormones because it regulates the skin pigmentation. Okay, so done na po tayo sa anterior pituitary gland. I think meron tayong 7 hormones that are under your anterior pituitary gland. Pupunta naman tayo kay posterior pituitary gland. Nandito na po yung tinatawag natin na ADH or antidiuretic hormone. Your ADH stimulates the reabsorption of water by the renal tubes. Hyposecretion of this hormone can result in diabetes insipidus. So yung ADH natin, it inhibits the urine formation. Inhibits urine formation during high blood osmolarity and lowers blood pressure to avoid dehydration. Again, under your posterior pituitary gland, nandito yung sikat natin na hormone, which is what we call the antidiuretic hormone. It stimulates the reabsorption of water by the renal tubules. Hyposecretion of this hormone can result in diabetes insipidus. And also your ADH, it inhibits the urine formation during high blood osmolarity and lowers blood pressure to avoid your dehydration. So, nagtataka kayo kapag ka ba nakikipag-inuman kayo sa mga friends during a party, bakit ihi ng ihi kapag ka nagiinom? Hindi naman po dahil sa sobrang dami ng ininom mo. Let's say, naka 250 ml ka lang, dalawang 250 ml ng sanmig, pero nakadalawang 2 to 3 times ka na umiihi or more than. This is due to the effect of the alcoholic drinks that suppresses yung antidiuretic hormone natin. So, pag nasuppress niya yon sa inyong posterior pituitary gland, humalo sa bloodstream, napunta doon, pag nasuppress yung antidiuretic hormone, wala na mag-i-inhibit sa'yo, okay, sa urine formation. So, mangyari, magpo-produce at magpo-produce ka talaga ng urine. Okay? So, for the hypersecretion of your ADH, pag hypersecretion, dito na tinatawag natin na SIDAH. SIADH, sorry. Okay? Ano po ba yung SIADH? Narilito, SIDH. So, yung condition na tinatawag natin na SIADH, ito yung kung saan yung katawan natin nagpo-produce ng masyadong antidiuretic hormone. Ang ibig sabihin po ng SIADH is the syndrome of inappropriate antidiuretic hormone secretion. Again, pag hypersecretion ng ating ADH into our body, nandito na pumapasok yung condition na SIADH. It is the syndrome of inappropriate antidiuretic hormone secretion. Next, kapag ka naman po hyposecretion ng ating ADH, okay, dito na pumapasok yung diabetes insipidus. So, napapansin ninyo, yung mga patient natin na may diabetes insipidus, they tend to mag-urinate po silang madalas, polyuria, madami yung volume ng urine nila. Tapos, madalas silang mauhaw, ayan, kasi po absent or mababa yung production noong antidiuretic hormone into their body. Next, under pa rin po tayo ng posterior pituitary gland. Dito na pumapasok yung oxytocin. Familiar naman na po tayong lahat kay oxytocin. Oxytocin. It stimulates the uterus to contract during labor, delivery, and parturition. A synthetic version of this hormone used to induce labor. Na yung nabanggit natin dati sa discussion natin. Is called pitocin or pitokin. It is also stimulates the mammary glands to release the milk. Okay, yung oxytocin natin, wala naman pong known toxicity nito ng hyper and hyposecretion. Plus, your oxytocin is involved in sex affection behavior promoting couple bonding. So, ang ating oxytocin, hormone siya na nagsistimulate ng contraction during your labor sa ating mga pregnant women. Also, involved siya sa sex and affection behavior that promotes couple bonding. So, ang sabi po nila kapag ka daw po nagkakaroon ng sexual intercourse ang male at female, yung mga female nagre-release ng oxytocin doon sa kanilang bloodstream, tapos nagkakaroon ng attachment doon sa guy na nakanilang nakakamate. Okay, so yun, yung hormone na nare-release. Yun yung tinatawag na oxytocin. So, done na po tayo sa posterior pituitary gland. Kaunti lang siya compared kay anterior pituitary gland. Punta na tayo sa thyroid gland. Thyroid gland plays a vital role in metabolism and regulates the body's metabolic processes. Again, the thyroid gland plays a vital role in metabolism and regulates the body's metabolic processes. Dito pumapasok yung calcitonin natin na hormone. Okay, your calcitonin influences the bone and calcium metabolism. It maintains a homeostasis of calcium in the blood plasma. What else? Ano pa pong masasabi natin tungkol kay calcitonin? So, since your calcitonin influences the bone and calcium metabolism, it also causes the increase of glucose. Increase of glucose and also inhibits protein synthesis. Inhibits protein synthesis. And it is also a immunosuppressive and anti-inflammatory. Again, punta tayo kay thyroid gland and then yung ating thyroid gland, ito siya. Okay, it plays a vital role in the metabolism and regulates the body's metabolic processes. So yung unang hormone na binanggit natin, which is under the thyroid gland, that is what we call your calcitonin. It influences the bone and calcium metabolism, maintains a homeostasis of calcium in the blood plasma. It causes increase in the glucose, inhibits protein synthesis, and is a immunosuppressive and anti-inflammatory. So what is the clinical significance of your calcitonin? Pagka po may overproduction or hypersecretion of calcitonin, yun yung tinatawag natin na Cushing syndrome. Kapag ka naman po hyposecretion, yun yung tinatawag natin na Addison's disease. Okay, sa calcitonin yan ha, wag pong kalilimutan. Hypersecretion, Cushing syndrome, hyposecretion, Addison's disease. Next, mapunta naman po tayo sa T4 at T3. Okay, thyroid hormones po itong mga nabanggit kasi thyroid gland tayo. T4 is the thyroxine, T3 is the triiodothyronine. So these T4 and T3 are essential to your BMR or basal metabolic rate. It is the rate at which person's body burns calories while at rest. Your BMR is the rate at which a person's body burns calories while at rest. It influences the physical or mental development and then the growth. Okay? Pag T3 and T4, kapag ka po may hyposecretion, a patient might have a condition on what we call cretinism, myxedema, and Hashimoto's disease. Okay? Pag hyposecretion, ang tawag na natin dyan, hypothyroidism. Okay? Which is also connected doon sa ating TSH. So kung ma-encounter nyo ito sa clinical chemistry and then sa inyong real life setting, laboratory setting, kapag kapon mga patients na sinususpect for hypothyroidism, usually niyan ipapatest dyan is yung T3, T4, and also yung TSH, thyroid stimulating hormone. So going back, pag hyposecretion, dito na pumapasok yung hypothyroidism, okay, which has these different conditions on what we call cretinism, myxedema, and Hashimoto's disease. Yung ito, Hashimoto's disease, yung may parang bukol na po sa may leeg. Hypothyroidism. Usually, yung mga patients kasi natin na may hypothyroidism, they are usually chubby or fat. Kasi nga, it affected yung basal metabolic rate. So, kahit na nag-exercise, medyo mataba pa rin po sila kasi nga masyadong mababa yung secretion ng T3 and T4. Hindi nare-regulate yung kanilang burning mechanism ng kanilang mga calories. Also, it is your T4 and the T3, it is involved in the metabolism, growth, and development like what we've mentioned. And kapag ka naman po hypersecretion ng T3 at T4, doon na pumapasok yung mga Graves' disease, yung mga goiter, and then base dose disease. Pag mga hypersecretion, yun yung mga malalaki na yung mga mata, Di ba ito sobrang payat po ng mga pasyente natin na merong hyperthyroidism or hypersecretion of T3 and T4. So, mapunta naman na po tayo ngayon kay ating parathyroid gland. So, we're done with your thyroid gland, anterior pituitary and posterior pituitary. Let us proceed to your parathyroid gland. These are the two pairs of parathyroid glands are located on the dorsal. Pag dorsal, nasa backside yan ng thyroid gland. They secrete yung PTH. PTH is the parathyroid, which plays a role in the metabolism of your phosphorus. Again, your PTH plays a role in the metabolism of phosphorus. Too little results in cramping and too much results in your osteoporosis or kidney stones. So, wait lang po. Okay, again, your PTH, mainly they are involved in the metabolism of the phosphorus and they regulate calcium and phosphate levels in the blood. Pag pinag-uusapan yung mga regulation of the phosphate levels in the blood, automatic PTH agad yung papasok sa isip natin. Parathyroid, which is under parathyroid gland. Okay, mas madali po siyang kabisaduhin. So, ito siya. Okay, nandun sa likod, dorsal back side. Next, we have the pancreatic islets or islets. The islets of Langerhans are small clusters of cells and they are located in the pancreas. Also, your pancreas is in your abdomen area. So, dito na pumapasok yung mga different hormones natin that are important in the body. Pakitandaan po yung mga pancreatic islets natin sa beta cells, they secrete the hormone insulin. Lagi po nating naririnig yan, which is essential for the maintenance of normal blood sugar levels. Because these hormones, they promote yung pagpasok po ng mga glucose natin papunta sa ating mga cells. So, pag nakapasok yung mga glucose na yun papunta sa ating cells, magagamit siya ng ating cells for different functions. Whereas, pagka wala ka masyadong insulin or mababa or depleted yung insulin mo, may tendency po na humina yung pasyente kasi nga hindi nakakapasok sa mga cells yung glucose. Nandun lang siya sa bloodstream. Okay? Kaya po, yung inadequate levels ng ating insulin, it results in diabetes mellitus. Imbis na makapasok yung inyong mga glucose sa inyong cells para magamit sa different functions, ang nangyayari na pupunta lang siya sa bloodstream. So, mataas yung glucose level sa bloodstream. Okay, next, we have the alpha cells. It facilitates the breakdown of glycogen to glucose, pakitandaan, and this elevates the blood sugar. Next, we have the delta cells. It suppresses the release of glucagon and insulin. So, yung insulin natin, it is released and triggered pagka kumakain tayo. So, kumain ka ng isang cake, yung inyong pancreatic islets, magre-release po yan yung beta cells, yung magre-release ng insulin yan. Na-trigger po kasi siya due to a stimuli. Ang stimuli mo, yung kumain ka ng cake. Next naman, yung glucagon naman natin. May insulin and then the glucagon. Okay? Your glucagon, it is released because of the trigger on what we call fasting. Okay? Yung nag-fast ka, nag-starve ka. So, nare-release po yung glucagon dahil po sa stimulus na fasting. Okay, excuse me. Okay. Next, pumunta naman po tayo sa pineal gland. So your pineal gland, it communicates information about environmental lighting to various parts of the body. And then, has your melatonin pala, yung pinag-uusapan natin doon. Una, melatonin muna. Melatonin, it communicates information about environmental lighting to various parts of the body. And then has some effect on sleep-wake cycles and other biological events connecting to them, such as lower production of gastric secretions at night. So kung matatandaan ninyo, pag may mga patients po tayo na hindi makatulog, pine-prescribe po sila to drink yung melatonin because it is involved doon sa pag-sleep-wake cycle natin. Okay? Yung melatonin, it triggers yung mga different warning signs, lalo na kapag sa gabi, na wag daw masyadong mag-produce yung ating gastric secretions, lalo na kasi sa gabi. So it was mainly affected by your melatonin. So next po. Okay, pineal gland. Under pa rin po tayo ng pineal gland. Yung pineal gland natin, it is a pine cone shape. About 1 centimeter lang. Maliit lang po siya. Dito. Ayun, dito. So next, under pineal gland is the serotonin. Okay, under ng pineal gland, tapos na tayo kay melatonin, nandito na tayo kay serotonin. It is a neurotransmitter that regulates intestinal movements and affects appetite, the mood, the sleep, the hunger, and then the metabolism. So next, mapunta naman tayo kay adrenal glands. This is the triangular shape adrenal glands are located on top of each kidney. Dito siya. Ayan, of each kidney daw po. So dalawa lang naman yung kidneys natin. Meron tayong dalawang triangular shape dyan sa ibabaw. The inside is what we call the medulla. Adrenal medulla, yun nasa loob. Pag nasa labas, adrenal cortex. Again, meron tayong dalawang kidney, merong dalawang adrenal glands dyan na nakapatong. Doon sa labas, ang tawag ay sa loob, medulla, paglabas, cortex. Okay? Pakitingnan po sa picture. Okay. So for the adrenal cortex muna, yung outer layer muna yung pag-usapan natin, we have these two, ito nga ba siya? Four different hormones that are regulated in the adrenal cortex. Unahin natin si cortisol. It regulates carbohydrate, protein, and fat metabolism and has anti-inflammatory effect. It helps the body cope up during your stress. Pag hypersecretion, hyposecretion, Addison's disease. Pag hypersecretion, Cushing's disease. Okay? So again, our cortisol, since they are in the kidneys, they regulate the carbohydrate, fat, and protein metabolism, and they are responsible for the water and electrolyte balance. Kasi nga nandun sila sa kidney na part. Okay? And then, also your cortisol is the most abundant corticosteroid hormone. Most abundant corticosteroid hormone. And then, it is being regulated by your ACTH. Again, cortisol, it is responsible in the regulation or the metabolism of carbohydrate, fat, and protein, like what we've mentioned. It has anti-inflammatory effect. It is the most abundant corticosteroid hormone. Okay, and mainly regulated by ACTH. Pag hyposecretion ang pinag-uusapan, hyposecretion, Addison's disease. Pag hypersecretion, yung mga Cushing syndrome yan. Cushing syndrome natin yung mga yan. Addison's disease. Ito yung kanilang mga clinical manifestations. So next, yung corticosteroid natin, like your cortisol, it is a steroid. It influences the potassium and sodium metabolism. Like cortisol, carbohydrate, protein, and fat. So next, nandito naman tayo kay aldosterone po muna. Tingin po muna sa ating right side. Aldosterone is essential in regulating electrolyte and water balance by promoting sodium and chloride retention and potassium excretion. Mainly, it is involved in the reabsorption of your sodium in the renal tubules. Okay? Pag masyadong mataas yung secretion, it causes hypertension. Bakit? Meron po kasing water and sodium retention. Again, it causes hypertension kasi nga sumusunod yung ating water sa sodium. So, pag mataas yung aldosterone, mataas din yung blood pressure. Okay? Example niyan yung mga ating Conn's syndrome. Pag mababa naman, okay, it will lead to severe water and electrolyte abnormalities, which is not good din naman, di ba? Pag mataas yung blood pressure, mataas yung sodium sa mga Conn's disease, pagka naman mababa, may mga severe water and electrolyte abnormalities. So sa androgens naman, mapunta naman tayo sa androgens, which is under pa rin ng ating adrenal cortex. Several hormones including testosterone, they promote and develop the development of your secondary sex characteristics in your males. Again, several hormones, including testosterone, they promote the development of secondary sex characteristics in the male, such as yung mga beard, ayan. Nandyan po yan. Mga hair, ayan. Next, nasa adrenal medulla na tayo. Nandito sa adrenal medulla si dopamine. It is used to treat shock. What hormone is being used to treat shock? Dopamine. It dilates the arteries. Okay, dilate yung pinapalaki, 'di ba? Dilated. Elevates systolic blood pressure and increases the cardiac output and increases urinary output. So, may mga patient na hinimatay. Ayan, dopamine is used to treat yung mga shock patients natin. So, under ng ating adrenal medulla is the epinephrine. It's also called adrenaline. It elevates the systolic blood pressure. What does your epinephrine do? What does this specific hormone do into your body? It elevates systolic blood pressure, increases the heart rate and cardiac output, speeds up the release of glucose. Mahalaga pong tandaan ninyo na pag na-release yung inyong epinephrine, it will speed up the release of glucose. So kung may mga emergency cases po such as mga nasunugan, napapansin ninyo, nagugulat ka, meron kang kakilala na nabuhat yung ref. So, ang liit niyang babae pero nabuhat niya yung ref. That is mainly because of the epinephrine or the adrenaline. Kasi nga, nagsispeed up yung release ng glucose. Ang nangyayari, yung mga cells mo, mas madami na siyang glucose, mas kaya na po niyang gawin yung mga different functions or activities such as pagbubuhat ng ref. Okay? Next, si norepinephrine naman. Like epinephrine, this is released when the body is under stress. It creates the underlying influence in the fight or flight response. As a drug, however, it actually triggers a drop in the heart rate. Okay, itong epinephrine and norepinephrine natin, these are collectively called as catecholamines. Under sila ng catecholamines. And catecholamines are under your amines. Okay? Next, mapunta na tayo sa ating ovaries. Ovaries, we have the estrogen hormones and the progesterone. Your estrogen, okay, the development of female reproductive organs and secondary sex hormones. Your estrogens are responsible for the regulation of your menstrual cycle. Estrogen po, menstrual cycle. Okay. Also, the maintenance of the pregnancy. So, estrogen responsible for the regulation of menstrual cycle and maintenance of the pregnancy. 1 and 2. Okay. So, ano po yung major estrogen na napoproduce ng ating ovary? Yun yung E2. E2. Ano ba magandang mnemonics dito? E2. E2 is the estradiol. Okay, yun din yung most potent estrogen natin and it is produced by your adrenal cortex. So for the ovary, we have the estrogen that is mainly responsible for the regulation of menstrual cycle and maintenance of the pregnancy. Meanwhile, your progesterone, okay, your progesterone is the preparation of uterus for ovum implantation and then the maintenance of the pregnancy. Okay. So again, your estrogen is essential for the growth, development, and maintenance of female sex organs. So if we're done with the ovaries, papunta naman na tayo sa ating testes. Sa male naman na yung pag-uusapan natin. So your testes produce the male sex hormone called testosterone. Again, the testes produce the male sex hormone called testosterone. So yung mga babae, wala talaga tayong testosterones, even small amounts, kasi wala naman po tayong testes. It is essential for normal growth and development of the male sex organs. Testosterone is responsible for the erection of the penis. Next, mapunta naman po tayo sa ating gastrointestinal mucosa. Like what we've mentioned, hindi lang yung mga glands that are under the endocrine system are capable of secreting and releasing these following hormones. Meron din mga body organs such as yung gastrointestinal mucosa, the mucosa of the pyloric area of the stomach secretes your hormone gastrin. Ang tawag doon, gastrin, which stimulates the production of the gastric acid for what? For digestion. Next, the mucosa of the duodenum and jejunum secretes the hormone called secretin, which stimulates the pancreatic juice, bile, and intestinal secretion.